it's World AIDS Day coming up now.
Tomorrow, as a matter of fact.
It is, yeah. It's fun. What's it mean to you? Because you've got so much experience in the LGBTI world.
Well, you know, the whole HIV epidemic started in the 80s in San Francisco and New York and various
You
places
lived there
in
at
the
the
state.
time,
Yeah, I
didn't
was
you?
living
Yeah.
in San Francisco at the time, and it was a real shock to the system, I have to tell you, because at that time nobody knew what the heck was going on. So when a person was HIV positive, they sometimes didn't even know. Maybe they were even carrying the virus for a long time, but it was a death sentence right off the bat. And people lasted maybe a week, people lasted maybe 3 months, maximum maybe a year. That was how fast people were dying in San Francisco. And I lost a number of friends. That was a bit of a depressing time, you know, a decade. One of my best friends, David, he passed away soon after I left San Francisco, and the last time I saw him, he was in a hospital bed. He'd lost so much weight. He was having, I think it was pneumococcal pneumonia or whatever, that disease. Some of my friends who I went and visited in hospital, you know, before that, who were dying, I mean, they had not only the pneumonia, but they had, you know, the sarcosis, sarcoma. They had all kinds of, you know, horrible stuff happening, and just you see them just wasting away, you know, in front of your eyes and suffering the most agonizing death. So it wasn't really very easy to watch that, and it was quite depressing. And that was one of the reasons actually I chose to come back to Sri Lanka as well, because I couldn't really deal with all that, you know, grief at losing, you know, my friends.
Yeah.
And anyway, it was a bit of a respite after I got back here, because I didn't really know anybody with HIV until I met Nigel.
At the time, what did people in Sri Lanka know about HIV?
Not very much in the early 90s, yeah. I mean, I think the whole HIV intervention kind of started in 95, 96, like that, and that also on a very cursory level. And to be very honest with you, I don't think that the interventions in Sri Lanka, you know, really cover the LGBTIQ community as well as it should. There's still a lot of stigma and discrimination. But Nigel was one of those rare individuals who, no matter how hard the odds were, he just came out smiling all the time, you know. And his story is like really, really terrible. But I'm going to tell you that story right now, because I think he would like that story to be told. So Nigel was an extremely creative person. He was a fabulous cook. He was an entertainer. He was a drag show performer. And he did all kinds of things. He would sew, he would, you know, make decorations. I mean, this guy was so creative. Every pore of his body was, you know, creative. And he was working on a cruise ship. And he was raped by somebody on the cruise ship. And that's how he got HIV. And of course, when he was diagnosed with HIV, he lost his job on the cruise ship as well. He came to Sri Lanka, and unfortunately his family didn't accept him, you know, because he was HIV positive. And also by this time, I guess they realized he was gay as well. So he went out on his own. He was working with various, you know, a radio station and someplace else. Each time these people found out he was HIV positive, he lost his job.
How old was he when he got HIV?
I think he was like 18, 19,
Wow.
you know, a very young age. And, you know, eventually there was a time when he lived on the streets. Basically, he told me that he would be picking through garbage cans for food. That was how desperate and bad things got. But right throughout all of that, I mean, he was still smiling, you know. This guy had a huge heart. So anyway, to cut a very long story short, he then started working for HIV, you know, I think with various organizations. And he was doing a lot in that area. And then eventually he joined Equal Ground in 2008. But of course, prior to that, when Equal Ground first started in 2004, when we were actually putting the organization together, Nigel was one of the founding members of Equal Ground. And I think the crux of it all was, one day I said to him, I said, you're just wasting your talents by just floating around, taking these odd jobs and, come and work for Equal Ground because you were part of, putting it all together. So he came and worked for Equal Ground in 2008. And he did a lot for us, and he actually, spearheaded our, foray into the rural areas to talk about, sexual orientation and gender identity. But
was he from a rural area as well?
Who, him? No,
Yeah.
he was actually from Dehivala, which is
Okay.
a Colombo suburb. But he did a lot for HIV, and when he died, prior to his dying, his blood count went really way down, and he was put on antiretroviral drugs, and he had a really bad reaction to that, and he kept fighting taking it, but he had to do it. So he took it, he stopped, and then finally he kept on taking it. But I think at the end, when he died of a massive heart attack. What triggered that heart attack, we don't know yet, but because he was also a heavy smoker. But what was very tragic after he died was the fact that his body was sent immediately to the police morgue. Jayaratna Funeral Parlor, I think, was the funeral arrangers that his parents, his family decided to hire for this thing, and they couldn't. The police had basically told Jayaratnas, well, this guy died of AIDS, so don't touch the body. And they were scared to do an autopsy because he was HIV positive. And they kept his body frozen until the day of the funeral. They did not release the body for embalming or anything. And much against his wishes, he was buried. He had always told me, Rosanna, make sure that I'm cremated. He didn't want to be buried. But because the police felt that if there was any kind of inquest later on, they might have to exhume the body, they decided that they were going to, So basically, Nigel's body was, and we tried everything, even asking the very people that Nigel worked with in the past, like those, doctors at the National Health Institute that worked on the HIV AIDS issue with Nigel, to please do something to, release his body so that, we could, pay him the respect that, he deserved as, an HIV activist, as a human rights activist, as an LGBTIQ activist, and they wouldn't touch it. They didn't do anything, Finally, I had actually spoken to my friend at AF Raymond's, and he said, listen, we'll charge the same thing as Jayaratna's, just let me know, I will get the body released, don't worry, blah, blah, blah. And when I approached his parents, the father said yes, and then the brothers intervened and said no, that they're going to go ahead with Jayaratna's, because I think they were ashamed of Nigel, at the end of the day as well, even though Nigel was the chief caregiver for his mother, who had passed away 1 year earlier. And his body was released at 10 o'clock in the morning. His funeral was at 3. I mean, basically, he was just like defrosting in front of our eyes, because he had been frozen for 3 days. It was just really a horrible, horrible experience, and it's not something that, I can swallow really easily, because there was such indignity in his death, and it should have been a dignified death, because he had done so much. So anyway, and I'm getting tears in my eyes. I don't want to talk about something else. But that's my experience with HIV/AIDS. It's been horrible, and I just feel that as activists, we really need to do more for the people in Sri Lanka, because right now we may still be a low prevalence country for HIV, but it is growing, and it is,
But from what I learned as well is that reporting is very poor.
Yeah.
So the people are afraid, first of all, the people are afraid to get tested. Then the people are not reporting, they don't use the resources available where they could and should. And then lots of people engage in high-risk sex. Maybe because they have never had a story like yours. And one of my friend from Mexico, he's always engaged in high-risk sex because he's a model in Mexico and he's been around everybody just to have sex for his advantage. And obviously, like, he's been bottom and he's not used protection, so eventually, unfortunately, he got it. But what really got me was another friend of mine who's very close to my heart, and he's very close because I was the first person in his life he kissed, and he's much younger than me, and he's from Cuba, and he always used protection, and he's also bottom. So what he did is he was with a friend of his who's also bottom, his best friend in Cuba, and he didn't know that his best friend was HIV positive. They were both penetrated by a top guy, but using the same condom.
Right.
So it was a freak accident. It normally doesn't happen, but you can never be sure.
Absolutely.
And it even taught me a lesson, because I would have never thought about this being a possibility, but it does happen. So people need to make sure that they get protection. That's the most important thing, isn't it? Like condoms and lube. Then they know how to use it properly. They know how to put it on, and then they don't use it for two different people as well, because things can happen. And now I think he's 22, and it's very difficult for him. He wanted to go abroad. He can't anymore because none of the countries will accept
right.
him anymore.
No, it's really sad because, I mean, when talking about the Sri Lankan context, for example, I mean, we are so afraid to mention any of the words that you even mentioned just now. It's really a shame that, I mean, in Sri Lanka particularly, that people are so afraid to use the words that you have even used, or to even acknowledge the fact that, same-sex unsafe behavior is happening.
Yeah.
Now, one of the huge deterrents, I think, for the LGBTIQ community here is that the fact that, same-sex relationships or same-sex sex is criminalized under the penal code. And while we have been working very hard to try to, overturn or change these laws, the bottom line is that the health ministry has an obligation, while receiving funds for, HIV/AIDS interventions, to get rid of that law and open up, the whole HIV intervention to make sure that the entire LGBTIQ community is served by their interventions, not just the men. I think for too long, all of this MSM business has focused only on men. What they fail to realize is that in our country, there are forced marriages, and therefore, men are infecting women.
Yeah.
Therefore, women are possibly infecting other women and other men, and therefore, possibly even transgender persons are being, and lesbians, and everybody are being infected.
Yeah.
And nobody cares, because nobody has done a study, was what I was told. I said, nobody has done a study because they don't really want to, because, who cares about women, especially in this country? Who cares about women? Yeah? So our thing is, at Equal Ground, we want to focus on all segments of the LGBTIQ community. Because I think it was said very well at the CHOGM recently, at the Commonwealth Heads of Government meeting recently, that no one shall be left behind. And it's very hypocritical, because everybody comes up with all these various slogans about no one being left behind, and human rights for all, and equality for all, and blah, blah, blah. But at the bottom line is, it's equality only for men, It's only equality for heterosexual men.
Yeah,
they don't really care about, the others. So if you are from a marginalized community, if you're a sex worker, if you're a transgender, if you're LGBT, beach boys, whatever, these are frowned upon, they are looked down on. And while, FPA and various other organizations are really trying hard to reach out to these people, I really think that it's incumbent on the government to start the ball rolling by decriminalizing homosexuality to start with, and reaching out to the LGBTIQ community protecting them, protecting their rights, protecting them as people. Yeah.
Because if you see in Western countries, the ball only really got rolling after decriminalization.
Right.
In all the countries,
Exactly.
Because otherwise it's so difficult to reach the groups as well, because they're afraid to come out.
Absolutely.
Because they are.
Because it's a double stigmatization, isn't it?
It is, yeah.
A, you're stigmatized because you are LGBTIQ. B, you're stigmatized because you might have HIV.
Yeah.
And for a very long time, and I think still, in order to get free testing for HIV, you have to walk into an STI clinic in Sri Lanka.
Yes.
I'm not going to walk into an STI clinic, you know?
I have, and I can tell you it's not always the best experience, really.
Absolutely.
Yeah.
And there's no anonymity,
Yeah.
even in private hospitals, because one of our previous colleagues had this issue where he had gone to get tested at one of the leading, private hospitals in Colombo. And while sitting there waiting for his results, the woman, announced his name and said, the person who's here for HIV testing. So the entire waiting room knew he was there for HIV testing. So it's traumatic for the person.
Of course.
I mean, he's sitting there wondering whether he is or he's not HIV positive. That's traumatizing enough. There is no pre or post test counseling for the person to figure out, how to get through this ordeal. And then, the receptionist is announcing to the entire world that, this person is here for HIV testing.
Yeah.
So, I mean, there's a lot of lapses on the part of the interventions taking place in Sri Lanka. But I think with a little bit more advocacy around the issues, we really need to, start changing things here.
Yeah, that's where we're going as well, isn't it? That's our plan, advocating and lobbying towards legalization.
That's right.
And then we can focus on other things.
Yeah.
Because you need a lot of expertise, don't you, for health issues, health-related issues.
Absolutely. So our last message, to everybody out there in the LGBTIQ community, specifically in Sri Lanka, since we are in Sri Lanka and we are working for the rights of LGBTIQ people here in Sri Lanka, is please don't take anything for granted. Have safe, protected sex, whoever you are. It doesn't matter whether you're a woman or a man or a transgender. It doesn't matter. Please be safe. And please, if you have any issues that you need to talk to us about, we'd be happy to answer your questions on HIV or sexuality, sexual orientation, gender identity, anything. At Equal Ground, we care about all of you out there in the community, and we are here for you.